Hi everyone, welcome back to the AAFE Training Center. I'm Meg.
And I'm Jill, and these are the most frequently asked questions about dermal filler. Alright Meg, you want to get started?
Yeah. Are there pre and post instructions for dermal filler injections? There certainly are. We like to tell our patients that prior to their appointment to receive dermal filler to avoid anything that could thin their blood, NSAIDs, anti-inflammatories, or alcohol, because that helps us prevent bruising. We also like to tell patients to be prepared to bruise. The face is very vascular, and so we want patients to be prepared for bruising. Post-op instructions are extremely important because we don't want the filler that we just placed to do anything it shouldn't. Filler is moldable for up to 24 hours after placement, and so we let patients know not to touch their face or do anything that could move that filler. We also don't want it destroyed by extreme body temperature, vigorous exercise, hot tub, hot sauna, anything like that. The sun. Our other piece of advice is we tell people not to let those puncture sites that we just placed in their face get dirty. So no sweating, no makeup that day if you can avoid it. Lots of clean things for your face, nothing old that's been sitting around for 20 years.
Alrighty, so my first question is, what is dermal filler? So dermal fillers are generally hyaluronic acid, and we use them to replace volume loss in our face. So for example, a nasolabial fold, or maybe even volume in the lips. So we use them for volume, but we also use them for contouring. So there are products that provide more shape and structure that we would want to use in the cheeks or in the jawline.
Perfect. All right, is dermal filler permanent? So different types of filler last different lengths of time. The fillers that Jill was talking about for contour in the face, typically fillers we use in the cheek or jawline. More structural areas last longer. Other fillers last shorter lengths of time, but our body does metabolize filler after it's placed. So when a patient comes for an appointment, we let them know that this filler should last up to this amount of time, but we do recommend maintenance in order to keep that volume up.
We always give the example to patients, you'd never let your gas tank get to empty before replacing it. So in order to maintain, we like to see you, sort of at scheduled intervals in order to maintain that filler.
That nice half tank mark.
Are dermal fillers safe? So this is a very good question. Dermal fillers can actually be very dangerous if they're not placed properly. So this is why it is extremely important to take a certification course where you learn how to properly place dermal fillers. The vasculature in our face, there's so much vasculature in our face, and too much product in one area or perhaps injecting into the wrong area can cause traumatizing end results that we don't want. So take a certification course, be properly trained, and then you'll implement all of those safe injecting skills once you're trained.
And we also recommend to patients research your injector's history and make sure that they are staying up on their education and that they are a safe injector as well. All right, where can dermal filler be used? So we use dermal filler in areas of volume loss. So examples in the face are lips, nasolabial folds, marionette lines, oral commissures, cheeks, jawline, temples, this lateral portion of the eyebrow. There's a lot of indications for filler in the face, which is really nice. In the neck, we can also use them for necklace lines, which is increasingly popular because people are starting to get a lot of tech neck from looking at phones all day. So that's another great place for filler.
Yeah, there's also two other places that are not commonly filled, but believe it or not, the earlobes. So for women who have that sort of saggy piercing hole, you can put filler in the earlobes. And then also we're starting to see it used a lot in the hands too as well, to sort of fight those aging effects on the hands. Can dermal fillers prevent wrinkles? That's a good question. So I would say Botox we use more to prevent wrinkles. When we're using filler, generally there's already experienced volume loss, and so we're replacing that volume to provide structure. Now with that being said, if we have proper mid-face structure here in the cheek, we expect less sagging or descent of the face which in turn will prevent those aging effects on the face. So I'm not sure if it necessarily prevents wrinkles. I mean, correct me if you think differently.
I'd like to think of these areas not as much as wrinkles, but of like creases and folds. It's great for creases and folds, whereas wrinkles come more from musculature and that sort of movement.
Right.
So I think that's how I would address that. Okay, can I get dermal filler results from anti-aging products? I think this means topical products, and I would say that no, you cannot get the same results from anti-aging topical products as you can from dermal filler. As we've said, dermal filler is placed in the tissue to amplify volume that has been lost, and anything that you're applying topically is not going to increase that volume, give you a little oomph to your tissue.
Right, but with that being said, dermal fillers and medical grade skin products go very, very well hand in hand. So, you know, for example, if you're treating a patient for tear troughs and their concern is their under eye, they should be using a really good under eye cream. So, you know, at this point when we're treating patients for the effects of aging, they should be on a very good medical grade skincare line. It's not going to give you the same effect as dermal filler, certainly, but it goes very well in conjunction with one another.
It is good teamwork.
Who can legally inject dermal filler? So this will vary by state. So you'll have to check with your state guidelines. In majority of states, it has to be at least a registered nurse that can inject filler and Botox. But in general, it's registered nurses, nurse practitioners, physician assistants, medical doctors, and dentists.
Where should I go for dermal filler treatments? We talked previously about making sure that you find an injector that does have that certification and education. If you go to the Facial Esthetics website, we have a doctor finder where you're able to find a provider in your area that is AAFE certified. I would certainly hope that patients would want to invest in their treatment, and so they'd be willing to find a good injector who's constantly educating themselves and who has a very high standard for his or her practice.
Absolutely. Okay, and for the final question, how can I become a dermal filler injector? Take an AAFE course, take a certification course. As we touched on, it is so important that you have the proper training in order to be a safe injector. So if you go to AAFE's website, you can look for some of our upcoming courses, and we hope to see you there.